It's a Tuesday morning. It's a little after 20 after 7, and it's time now for our weekly check-in with Dr. Isaac Bogoch, infectious diseases specialist. Dr. Bogoch, nice to see you again this week. Last week, I guess we're going to pick up on the conversation there. You said you thought the flu numbers for the province had peaked, and then days later we saw the charts.
Good morning, Peter. Good. How are you?
Assertion. So will the curve likely be as steep as the way up, or will it be a more gradual kind of reduction in cases? And how long should we expect this nasty flu to be sticking around?
Yeah, it's tough to know. In a typical year, we sort of see this gradual phasing out of influenza throughout January, February, and into early March. But we've also had years, for example, the 2022-2023 calendar year, where the flu season started many weeks earlier than it normally does, shot way up, and then it just plummeted. So as we say, the flu is predictably unpredictable, tough to know, but obviously thankful that it's on the decline. We had some pretty tough weeks just before Christmas and around the Christmas time. But thankfully, it's in the decline now. Still around, still got to be cautious about it, but certainly not as much of that circulating now than there was a week or two ago.
Yeah, I'm sure if it's anything like our workplace, we had so many people out for, 5, 6, 7 days, just dealing with the flu, really knocked out by it. So yeah, pretty nasty stuff. Okay, so here's the thing. Flu cases are coming down, but the graph, and I'm sort of basing this on a graph that you posted on Twitter, sort of X, and LinkedIn, showing that, flu cases coming down, but RSV and COVID cases on the rise. So is it too soon to think about maybe how bad those could get this year?
Yeah, we'll see. I mean, I think it's, we still have to remember it's winter in Canada and there's respiratory viruses circulating. It's obviously not just the flu. COVID has been around, but relatively quiet relative to the flu, which of course was circulating in very high numbers earlier. But it is starting to rise now. And, I don't think anyone would be surprised if we see more COVID, for example, as we enter the latter part of the winter and the early spring. And RSV, will probably start to see more RSV circulating in the later part of the winter, and that will very likely peter out as things warm up. RSV is kind of predictably seasonal. But again, we have these respiratory viruses, to no one's surprise. In winter in Canada, we have tools to prevent them. And we should be taking steps to prevent ourselves from getting infected, so we can have a healthy, happy winter season.
Okay, so speaking of prevention, then we all know how crucial hand washing is to staying healthy, but perhaps Dr. Bogoch, you could give us some of the other tips you have for making sure that we're sticking to healthy habits in this flu and other respiratory virus season.
Yeah, absolutely. These are viruses that are primarily transmitted through the air. And of course, mask mandates are long gone, but people can put on a mask to reduce the risk of infection, especially if you're in a crowded indoor setting. We have vaccines, so flu vaccines are available, although, it does take usually 10 to 14 days before the vaccine starts to kick in if you've gotten one. We've had these vaccines have been available for months, so if you haven't received a flu vaccine this year, it actually might be too late to get one, depending on what the graphs show. There might be debate on that. Some people might say it's not too late. Others will say it is a bit too late, but it is getting late in the season for a flu shot. COVID vaccines are available, and again, the Canadian guidelines recommend the COVID vaccines for people over the age of 65 or people with underlying medical conditions. And remember, there are respiratory syncytial virus, RSV vaccines for older Canadians. It's covered in Ontario as well for older Ontarians. And this is a vaccine that lasts for 2 years or more. And it does a very good job in protecting against severe RSV disease. And there's some excellent data demonstrating that. That's new for this year, the coverage of the RSV vaccine. So that can be very helpful, too.
Okay, this is all good information. Dr. Isaac Bogoch, we appreciate your time as always. Thanks so much. We'll see you next week.